everyone, this is Nicole and Alexis here to help explain to you what to do if you are stuck in an emergency situation.
We're going to break down step-by-step procedures in the two very common emergency situations that can happen to you in your afterway.
First, we're going to take a look at what you need to do in case of an obstructed airway. Pay close attention because if this happens to you one day, you're going to want to know what to do. An airway obstruction is a respiratory problem caused by an increased resistance in the bronchioles that reduces the amount of air inhaled in each breath.
The predisposing factors for an obstructed airway are due to having loose objects in the patient's mouth and having our patient laying in the supine position. Due to this patient positioning, objects have a greater tendency to fall into the patient's oral pharynx.
What we're about to see is Nikki, our patient, coming in for an appointment to have a temporary crown removed and have it replaced with the gold crown. Jamila, our clinician, is going to be taking care of Nikki. Let's see what happens.
Hey Nikki, how are you doing?
I'm good. What are we doing today?
Well, we're putting your gold crown in today.
Yay!
So we're gonna be taking off your temporary crown.
Okay.
And then we're gonna clean around it, and then we're gonna put your gold crown on. Okay?
Okay.
Real easy today. Okay?
Sounds good. No needles?
No needles.
Okay.
All right. So we're gonna go ahead and lean you back. Okay. Alex, can you put the suction in your mouth, please?
Not maybe.
Okay. Go and open. Alex, can you take the suction out and can you sit Nikki out?
Yes.
Nikki, can you try to cough for me? You can't cough anymore? Okay. Hey, Dr. G.
Yes.
Stand up, Nicole. I'm gonna do the Heimlich on you, okay? Okay. You okay?
Breathe. Yeah,
Are you
I'm
sure you
okay.
can breathe?
I'm
Take a couple
okay.
deep breaths. Better?
Yeah, I'm good. It's
okay.
out.
Okay.
It's
good.
out. I'm gonna
good.
sit back down.
So since the object is out of your mouth, I want you to go to the doctor's maybe because I could have damaged some ribs with the Heimlich. I'm not sure. I'm not 100%. I don't know if you feel pain or anything down there yet.
No,
it might come a little bit later. So just go into the doctor's and get that checked out and explain what happened. Okay?
Okay, no
All
problem.
Right, cool.
Thank you.
While Jamila was trying to remove the temporary crown, it accidentally slipped into the back of the patient's throat.
Jamila remains calm as she asks Alexis to remove the suction and begins to sit her patient up. She then turns to Alexis and tells her to get help from either the faculty or the doctor. Nikki starts showing signs and symptoms of having a partially obstructed airway. She starts to continuously cough and has her hands around her throat. The only thing Jamila could do right now is help and encourage her to cough. In case of a partially obstructed airway, the patient is the only one that can help expel the object by coughing.
But then we see that at one point, Nikki was not able to cough or speak anymore, and is gripping her throat. This was Jamila's cue that her airway has become completely obstructed, and it was time for her to stop and start performing the Heimlich maneuver. If our clinician does not act fast and remove this object from Nikki's throat, she could lose consciousness.
Our clinician instructs Nikki to stand up and let her know that she's going to start performing the Heimlich maneuver. Jamila was a success and expelled the object from her patient's throat. After she saw that Nikki was able to breathe, she took a few minutes and had her take a few deep breaths and made sure that she was okay.
When Nikki started to calm down, Jamila spoke to Nikki about what had just occurred and told her she should see a doctor to make sure nothing was injured during the Heimlich maneuver.
If the patient was not able to expel the object themselves by coughing and the clinician is not able to during the Heimlich maneuver, during the complete airway obstruction, the patient can lose consciousness. If this occurs, we as clinician must follow another emergency protocol and get the patient on his or her back and try to get the airway open and start CPR.
We as clinicians can prevent an airway obstruction by using rubber dam, trying to floss around loose objects, using suction, or help with a dental assistant, and never leave the patient alone when objects are in their mouth.
It is important that we recognize the difference between a partially obstructed airway and a complete obstructed airway. In the case of a partial obstruction, we will see the patient coughing, wheezing, placing their hands near the throat, and experiencing dyspnea, which is labored breathing. In a complete obstruction, our patient will be in distress, gripping their throat, will not be able to breathe or cough, start turning a bluish color, and if we do not act fast, they can lose consciousness. In the case of an aspirated object, which means that the object has been ingested, we need to get the EMS there immediately and have them transported to the hospital so they can have a chest x-ray taken.
And in conclusion, we as clinicians need to be alert at all times and act fast to help our patient in an emergency situation.
Now let's take a look at our next emergency for a patient who's experiencing hyperventilation. Hyperventilation. Our patient will be coming in today for a cavity that needs to be filled. Our clinician will need to administer local anesthetics in order to prep her for the procedure.
Hyperventilation is a state of breathing faster or deeper than normal. Some predisposing factors are when a patient is in a psychological state of panic, if they are experiencing stress or anxiety, or if they're taking a series of rapid deep breaths.
Let's see what happens to Nikki when Jamila tells her that she will need to have an injection for today's procedure.
How are you doing today?
Good. I'm really nervous.
Why? What's wrong?
Because I don't like the dentist. I haven't been, but I've heard bad things.
Okay, well, you only have a small cavity on the bottom right, okay? So we're just going to fill that for you.
Do I have to get a needle?
Yes.
Okay. I think I'll be okay.
You'll be okay, all right?
Yeah.
Okay, I'm going to go ahead and lay you back.
Okay.
Just go ahead and open if you can. What's wrong?
I'm having a hard time breathing.
Okay, I'm going to sit you up, okay?
Okay.
Alexis, can you come here for a second?
I'm getting really dizzy.
Is everything okay? Actually, I think Nicole might be hyperventilating. Could you get Dr. D for me?
Sure.
My chest is
you
really
okay?
hurting.
All right, well, okay.
Okay.
When Jamila tried to give Nikki the anesthesia, we saw that she started to show signs and symptoms of abnormal and prolonged rapid breathing, and says that she's having chest pains. Jamila then calls Alexis over for assistance to get a faculty member or the doctor to help. Our clinician sits her up and remains calm, trying to help her breathe and asking her if she is okay.
Other signs and symptoms a patient may exhibit would be twitching or muscle spasms, sweating, fatigue, or apprehension, and having heart palpitations.
As clinicians, we need to stay with the patient and help calm her down using breathing exercises. The first thing we need to do after getting help is get them seated up and loosen any tight clothing that they would have around their neck. Next, we need to work with the patient to try and control their breathing. We can do this by having them breathe through pursed lips or their nose, having them count to 10 in one breath, and sit next to them and breathe along with them.
We also need to monitor the vital signs, taking their pulse, respiration rate, blood pressure. Let's see how our clinician handles the situation.
All right, Nicole, just try to stay calm.
Jamila, Dr. G said to take her vitals, okay?
Okay, so can you help me? Can you stay with me for a little bit? And can you just help her control her breathing while I check her vitals, okay?
Okay.
I'm just going to check your pulse, Nikki.
Up your lips a little bit so you can... There you go. Very good. Try to relax a little bit. You feeling a little bit better?
Dizziness going away.
Okay. Calm down, that's good.
I'm just going to take your blood pressure, Nikki.
She seems to be she's a little better than before.
Yeah, everything's okay. Do you feel a little bit better?
Yeah, I feel better.
Are you sure?
Yeah.
Okay, well, you're probably just hyperventilating because of the needle,
Okay.
which is common. A lot of people do freak out about their dental appointments and the needle especially. Did you feel any chest pains while you were having?
Yeah.
You did feel chest pains? Okay. What about any numbness in your extremities, fingers, toes?
No, but I did feel a little bit around my lips.
Your lips?
Yeah.
Okay. Any twitching of muscles that you could remember?
Not that I remember.
Okay, and you were sweating a little bit.
Yeah.
So, okay, well, everything seems all right now. If you just want to go ahead and relax for a little bit, we're just going to keep you for a little bit longer, okay?
Okay.
Okay. So Nikki, I think it's best if we reschedule your appointment today because of what happened.
Okay.
Okay, and I'm gonna go tell Dr. G what's up, and then if you, Alexis, if you just want to go ahead and read her like
Sure.
stuff she can do before her next appointment, so this won't happen again.
Okay.
See you later, Nikki.
Thank you so much.
Okay, here a paper we have for you for next time you come in. Some things to do, like maybe breathe a little bit before you come in, relax, maybe a good breakfast before you come in. Take this with you for the next time you come in, okay?
Okay, so I should try to like get a really good night's sleep before I come in and
Yeah.
try exercise. So the anxiety was really probably what caused it. So I
Most
should just
likely,
try
yes.
to like kind of reduce the anxiety and things like
I mean,
that.
try to if you can, sure.
Okay. Thank you so
You're
much.
welcome. See you next
Thank
time.
you.
When Nikki started feeling better, Jamila asked how she felt during the attack and documented on her chart. We also need to keep the patient for a little while after to make sure they are relaxed and calm.
If the condition does not improve, we need to administer the recommended drugs or get them transported by the EMS to the hospital as soon as possible in case that this is a more severe problem. Ways to prevent a patient from hyperventilating in your operatory is by explaining step-by-step procedures during the treatment to help keep them relaxed. When scheduling their appointment, ask them if they have any fears or anxiety about the dentist so you know how to modify treatment for them. If they say that they are fearful, encourage them to get a good night's sleep, eat a healthy mix of food before their appointment, try some relaxation techniques, and also to learn some belly breathing techniques. If this is the first time your patient has experienced hyperventilation, you want to recommend these same techniques that Alexis just did for Nikki and also refer them to a psychologist for more treatment.
We hope this video helps prepare you for what protocols need to be followed if hyperventilation or airway obstruction happens to your patient while they're in your chair.
Remember, we're healthcare professionals, and we need to think fast and especially know what to do in case of these emergency situations. Because just think, if that was you in that chair and your life was in danger, would you trust yourself?